If you are one of the many would-be moms hoping to get pregnant this season, there are a few steps you should take to ensure a healthy pregnancy. Here with some advice is OBGYN and TV personality Dr. Jill. Good morning, doctor.
Good morning. Thanks for having me.
It's really great to have you on. Now, we want to talk about the season and which time of year is actually, what's the best time for women to conceive?
Well, the conception rates are the highest during the months of November and December. When it's cold outside, people are inside.
Right, so they have, nothing else to do. Now, what should women really think about when it comes to, getting ready to have a baby and sort of in the process? What are some tips that you have for them?
What I recommend is start taking your prenatal vitamins as soon as possible. I also recommend that you get in to see your primary care physician or your obstetrician and make sure that your medical conditions are in check, like high blood pressure, diabetes, and obesity. You want to make sure you're at a perfect weight to get your pregnancy started. And then one of the things that people don't commonly ask about but should ask about is genetic carrier screening, because there's tests available that you can have done to see if you're at risk of passing a genetic condition down to your baby.
Great. And now, we've heard of something called a biological clock. How does that affect women, and is it a real thing?
It is actually. The age of 35 is kind of when that clock starts really ticking, because you're at that point more likely to have medical problems like high blood pressure and diabetes, which can complicate your pregnancy. But also you're more likely at risk to have a baby with Down syndrome or other genetic condition. But nowadays there's better technology available as early as 9 weeks in pregnancy that can tell you if you're at low risk or high risk of having a baby with Down syndrome or other genetic condition.
Wow, the technology. Now, we talked about what women should do to ensure their health. What should men, and what kind of steps should men take to do the same?
Well, for example, if the woman takes the Horizon carrier screening test and sees that she's at risk of having a genetic condition for her baby, we recommend that the father has that test done as well, because then we can determine the risk that the two of them together can pass a condition down to their child.
Yes, and now during the winter, obviously it's a lot colder in some places. What should pregnant women be doing to sort of safeguard their pregnancy during the cold temperatures?
Well, for one, make sure you're getting to your routine OBGYN doctor's appointment, and you want to make sure that you continue taking your prenatal vitamins, exercise, eat healthy, and get as much sleep as you possibly can.
Great advice, Dr. Jill. Now, where can people go and actually learn a little bit more about this and maybe get in contact with you?
Well, I recommend the website natera.com, Natera.com.
Fantastic. Thank you for being on with us.
Thanks for having me, Alex.
All right. Now stay where you are. The Morning Blend will be right back.